Okay, so let's go ahead and get started. Again, thank you so much for attending. Just a quick background. My name is Brian Sanderoff. I am a traditionally trained pharmacist. I used to stand behind the counter doing that count, pour, lick, stick, type, and gripe things that pharmacists do. And a while ago in my practice, I came to understand that giving people those prescription medicines wasn't necessarily helping them as much as I would have liked to have been. And so I came to the understanding that in medicine, what we do is we turn the volume down on what the body's saying instead of really listen to what the body's saying. And with migraine headaches, this is especially true. So this really applies to the topic that we're talking about today. Um, and that's why in the title, sort of tongue in cheek, I wrote not just a Vicodin deficiency. And so um, of course, walking around with chronic headaches or the tendency to get these really bad headaches is not fun, and we certainly don't want people to walk around suffering. But when we just use pain medicines to treat the headaches, we're not really getting to the root. And that's the case with every one of the chronic diseases of aging that we try to avoid as we get older. Whether we're talking about blood pressure, cholesterol, or depression or osteoporosis or whatever, with the medicines, all we're doing is turning the volume down on the body, talking to us, and the body, in its wisdom, will find another way to talk to us. And so the analogy I always use is that of the dashboard on your car. If you're driving around in your car and you see the little red oil light illuminate on your dashboard, you have a couple choices. You can take it to the mechanic, find out what's wrong, and get it fixed. Or if not, just take a piece of black tape and put it over the light. You don't see it anymore. Well, in medicine, that's what we do for all the chronic sort of diseases is those medicines are really just the black tape. And so the bulk of the work that I do is to help educate people about what really is going on in your body so that you can then make more informed choices for yourself and your body will stop talking to you in the way that it's talking to you right now. And that's very well the case with migraine headaches also. And so that's what we're going to get into. Again, if you have some feedback, please feel free to type it right into the question box there and it'll show up right on my screen. Also want to point out that when we do these webinars, and I do one a month, we also record them. And so if you go to the website, you will find the recording library of probably 36 of these webinars now on all sorts of different topics. And this one will be recorded as well. I will repeat doing this live on Thursday evening at 7 p.m. Eastern Time. So if you want somebody to listen to it and participate in it, you can refer them to that. And if not, it'll show up on the website by within a week or so. So migraine headaches, not just a Vicodin deficiency. So let's get into the numbers a little bit. I always like to start off just talking about the prevalence because, and obviously this is an issue, and obviously people realize that. There's a lot of people online today, and that's because of how important this topic is and how much this topic and migraine headaches affect people's lives, obviously in a negative way. So number one, lifetime prevalence is about 18%. And so 18% of the public will have migraines at some point in their life. It does affect women more than men. Half of the people have a family history. Someone, I think it was Karen, had emailed me earlier saying that her mom had migraines also, and that's actually very common. Oftentimes people will get an aura before the migraine. Now that's not always, but oftentimes the case, and that aura can show up as vision disturbances, seeing waves and light and spots, or it can show up as anxiety or fatigue or disturbed thinking, numbness and tingling, and oftentimes that numbness and tingling is just on one side of the body. I put up here vascular versus non-vascular, and that's because migraines are known as vascular, and they are characterized by a throbbing or pounding sharp pain. There are other vascular headaches out there that you may have heard of called cluster headaches, or actually a hangover is an example of a vascular headache. And they also can be induced by toxins or drugs, certain prescription medicines or over-the-counter medicines. And then there's a whole host of what are known as non-vascular headaches. And these would be either tension headaches, they can be caused by sinuses, they can be caused by toothaches, and they're characterized by more of a steady, constant, dull pain. Oftentimes starting at the base of the skull. There's different types of migraines, and if you have migraines and you've gone to the doctor and you've gone to the neurologist and you've gotten quote unquote worked up about this, worked up, not excited, but that the doctor worked you up. There's different types of migraines. There's classic, there's common, there's complicated, there's variant. And my message about this is that none of that really matters when it comes down to you, because the type of migraine you have does not have any significant therapeutic, does not have any therapeutic significance. What that means is, if you have a classic versus a common, it doesn't mean that you get treated any differently, and it doesn't mean that we know any more about the cause of the migraine. And that's a really important thing to sort of understand, because in medicine, we like to chase our tails a lot, and we like to categorize things and pretend like we know a lot about something. And this is a good example of that. And so for some reason in our society, we've created this environment where if we know more and more about, the type and this and that and the other thing, that it means that we can take care of it better. And that's not the case with this. So regardless of the type of migraine you might have or someone may have, doesn't mean that you're going to be treated any differently, and it doesn't mean that we're better at treating that in medicine. A little bit about biochemistry, and I try to simplify this as much as possible. Now, I have been known to be called a biochemical nerd because I like biochemistry, and I think that understanding biochemistry really gives us the basis of understanding how to change things within our body and how the body works. But I've tried to simplify this as much as possible. So the older theory is that you get blood vessel constriction, and then that's followed by blood vessel dilation. I'm talking about within the brain. That dilation leads to stretching of blood vessels within the brain, which then leads to the activation of pain signaling nerve cells. And that is the genesis of how a migraine happens. Now, when I say old theory, I'm not saying that that's not necessarily correct or partially correct, but I'm saying that that is like the more established thought. But there's some other things to understand about this, and so I'm going to get into it a little bit. Number one, I wrote here platelet aggregation, and this is important to understand because the platelets of a migraine sufferer look different both during and between headaches from the platelets of people who don't get migraines. What we see is an increase in spontaneous aggregation and the composition, as well as significant differences in the manner of serotonin release. Now, I just brought into the picture a brain chemical called serotonin. And it's important to understand that platelets contain serotonin, and there are certain triggers in the body that cause those platelets to release serotonin, and that seems to be playing a pretty big role in ultimately what we experience as a migraine headache. The platelet aggregation is a precursor to vasoconstriction, which leads to the rebound vasodilation that I just spoke about, which ultimately leads to the release of that thing that's called substance P, which is a neurotransmitter that is known as the messenger of pain, as well as other mediators of inflammation. And you can think of that as being bad guys in this play that results in a migraine. There's newer research out there. I'm sure those of you who have migraines have heard this term, but the official medical term for somebody that suffers from migraine headaches are called migraineurs. And what we find is that people that suffer from migraines have different blood flow structure. A study using MRAs clearly shows that certain abnormalities in blood vessel structures that supply blood to the brain were seen in migraine sufferers. Oftentimes, these abnormalities were in the area of the brain known as the visual cortex, and this may actually explain why many folks have visual disturbances before and during migraine headaches. There are many, many other theories now that are coming to fore as we study and dissect this problem with, our more accurate tools that we use in medical research. So there are genetic links. There are overactive pain signaling from sensory neurons in the brain in certain people, and there's neurotransmitter activity. And so this is of particular interest in a major area of scientific research into the cause of migraine. It's also the main area of interest for pharmaceutical intervention. So when you look at many of the pharmaceuticals, other than just the pain medicines that we use to treat the pain, many of the pharmaceuticals have to do with looking to adjust or manipulate serotonin levels, or the sensitivity of specific serotonin receptors in the brain cells. And so we're going to talk about serotonin a lot because there are things that you can do herbally and nutritionally that play a very important role with serotonin levels and ultimately with helping to avoid migraines. Hopefully I'm doing okay, that you guys are getting all this. And again, don't forget, you can just type into that question box anytime that that you have a question or if there's something I need to address in a different way for you. This is a term that if you are a migraine sufferer, you know very well, and that's the term triggers. There are many, many common triggers to bring on migraines in susceptible people. The problem is that nobody has all of these triggers the same. And that is what is one of the difficulties in one treating migraines, especially from a medical perspective, because, if they can't find common quote unquote causes or deficiencies, then it's hard for medicine to treat it that way. And it also makes it difficult, maybe from a holistic perspective, typical though, because from a holistic perspective, we firmly feel that not everybody has the same cause to any problem. So, if I had 10 people in my room and they all suffered from diabetes, they would all have diabetes for a different reason. And it's the same thing with migraines as well. And that sort of goes against kind of medical thought, typical Western medical thought. And that's because we want to find a cause because that's how we want to fix it. So, for diabetes, everybody has diabetes from a medical perspective because they don't have enough insulin or their cells aren't sensitive enough to insulin. But that's just a symptom. That's not really speaking to the cause of why that is from person to person. And it's the same thing with the migraine. Many, many different triggers. So we're going to go through some of them. One of them is low serotonin levels. And again, this gets a little complicated to understand biochemically. Typically, we would see low serotonin levels in certain symptoms or health issues or challenges like depression or anxiety or sleep disorders or eating disorders or even OCD or bipolar. If we see somebody with having those problems, we would say, they have low serotonin levels. Well, as it turns out, migraines very well may be just another quote unquote symptom of low serotonin levels. Foods, there are all sorts of foods that can be triggers for migraines. And they can happen in a lot of different areas. So food allergies plays a very important role with this. And this can be different from person to person. I'm going to talk quite a bit about an elimination diet and how to identify which foods could be. The common ones that we could talk about are wheat and gluten and dairy, grains and cereals, cane sugar, yeast, corn, citrus, eggs, and then some chemicals that come in foods like, well, we'll talk about them in a second. There are histamine-containing foods as well. And the ones that you hear about most often are chocolate and cheese and beer and wine, especially red wine. And those of you that are migraine sufferers that have been through the grind medically and you've gone to the neurologist and if you've had that workout happen, you know that they've talked to you about avoiding those foods. Do you know why? Well, number one, those foods are histamine-containing foods, meaning that when you eat those foods, they have histamine in them. And histamine is a trigger in the body that in certain susceptible people can lead to migraines instead of what you would think of as normal histamine sorts of reactions, which would be allergies. So another way to say that is that in certain susceptible people, migraines really may just be an allergy, may be the result of an allergy. So there's an enzyme called diamine oxidase that helps break down histamine in the small intestines before it gets absorbed and circulates throughout the body. Migraine sufferers have been shown to have lower levels of this particular enzyme, again called diamine oxidase. Interestingly, vitamin B6 has been shown to increase the activity of that enzyme. That's why when you read about a natural approach to migraines, you may see that some people are told to take high doses of vitamin B6. Also, interestingly, is that enzyme in the small intestine increases by more than 500 times during pregnancy. And that may explain why some women who have chronic migraines will have those migraines go away when they're pregnant. Now, why would that enzyme increase during pregnancy? Makes perfect biochemical sense to me because histamine is a signal to the body that something in the body doesn't belong there. And that something inside the body could actually be a fertilized egg. And so the body will increase this enzyme to help cut down on histamine so that the body doesn't get the signal that that fertilized egg doesn't belong here and then undertake activities to get rid of that fertilized egg. So it's actually, preservation of the species on a very base level where that enzyme increasing allows for a higher likelihood that a pregnancy will, go to fruition. I think that makes kind of sense. It's kind of interesting. There's also chemicals in foods. And I'm talking about food additives like colorings and flavorings and all that kind of stuff, as well as artificial sweeteners. Under the food category can be withdrawal from caffeine and also could be hypoglycemia that I'll talk a little bit about as well. Because if you are hypoglycemic and you have dietary habits that are causing blood sugar spikes and then drops, that's another thing that can biochemically signal the body that ultimately can lead to migraines. And that's one that doesn't get talked about commonly when you talk about migraines. Stress, as you can see up there, is a really, really big issue, and I'll explain that a little bit more in detail. But the bottom line is that when we're under stress, and let me stress this fact: when you hear the word stress, oftentimes those of us, in the world have a negative connotation to that stress. We say, "Oh, stress," and we automatically think stress means bad. It's not necessarily the case. There are things that we would categorize as good that are also stresses on the body that cause that same stress response, which is the release of cortisol. An example of that would be somebody that exercises really hard. If you are a marathon runner and you go out and you run a marathon, we see that as a positive and good exercise and blah, blah, blah. But that also is stressful to the body and causes a tremendous release of cortisol, which can cause certain, chemical or biochemical results as well as that stress. So another example that would be, me personally, when I have a deadline facing me, like I have an article that's due to a magazine that I'm supposed to write, and that article is due tomorrow, that form of stress is one of the things that gets me up and moving and really gets me to do my best work. I still have that cortisol response, and that still has some negative physiological ramifications as well. And so stress plays a huge role with many of the other things. When you're under stress and your cortisol levels are high, that makes you more likely to react to foods, for example. And so all of those food allergy and those hidden food sensitivities can be worsened when you're under stress, and it can affect other things as well. Emotional changes can really be a trigger for migraine headaches, and many people have experienced that when they get upset, when they're nervous or anxious. Now, understand that link between those emotions and serotonin levels, because they may be just further examples of a serotonin imbalance, or when emotions are happening, that changes serotonin levels, which then can lead to the migraine or the headache. Hormonal changes, same thing. And I will tell you and link stress to emotional changes and hormonal changes. Because, when you're under stress, you're instructing your body to create cortisol, which then leads to some physiological changes. Well, your body uses progesterone to make cortisol. And when your progesterone levels drop, which happens when you're making cortisol, then you have a hormonal imbalance, which then leads to other hormonal changes, which can lead to migraines. And many women who have migraines experience that the migraines are one way or another related to their menstrual cycles. Sleep also plays a tremendous role with with migraine. And I'm talking about too much sleep or not enough sleep. And the quality of the sleep, we're starting to learn, is really related to things. And so if you have sleep apnea, what that means is that you're not consistently getting into the deeper sleep, the deeper levels of sleep, which means that It's a tremendous stress to your body because your body's not getting the opportunity to regenerate and repair, and it causes higher levels of cortisol, which are related to high blood pressure issues, are related to sugar issues, and now we're finding also related to migraine issues. And then the last one is actually weather changes, which is something that, again, somebody had alerted me to that seems to be a trigger for them. Changes in barometric pressure can bring on migraines, and there's some specific reasons why that can happen. Next screen up here says prevention versus treatment. Now, obviously, we want to treat the pain. And I can tell you that I've worked with patients who walked into my office and literally said, I have not known a day of pain, a day without pain for the last 20 years. A particular patient I can think of in particular told me that when we first sat down. And, obviously, heart goes out to somebody like that, not knowing a day without pain for 20 years. And so the treatment part of it is great. Obviously, we don't want to walk around in pain. And so if you are having a headache and you need to take something to treat the pain, that's one thing. But just understand that that is not fixing a problem. That's just turning the volume down on what the body's saying. And what the rest of what we're going to talk about today is actually listening to what the body's saying so that we can make it so the body does not have to talk to us in that vein anymore. So really, now we're going to talk about prevention. And so step number one is looking at the diet, and you really have to take this seriously. And this may be the hardest thing for migraine sufferers to want to, one, understand, and two, address. And the reason is because, I believe, is because of the way our medicine works in this country, because we wait till we have a problem, then we go to the doctor, and the doctor wants to make that problem go away. And when it comes to a chronic pain condition like migraines, we just want to give medicines that stop the pain. And understanding that your diet and how you relate to food is probably the key underpinning. Understand, this is step number one, is the key underpinning to you suffering from migraines is the utmost importance in making those migraines go away or the susceptibility go away. Now, again, one of the difficulties here is that it's very individual. It's different from person to person. And so if one person, can eat a particular food or eat in a particular style and it doesn't cause migraines, well, we have the tendency to say, oh, well, it's not the diet. It's not true, because we have some inherent genetic susceptibilities, and we understand that up to 50% of people that have migraines have a genetic link to it. This is the part of that, the susceptibility. Your genes afford you different possible futures. Which future comes to pass depends on how you bathe your genes and your experiences, diet being the main one when we're talking about migraines. Also, how you deal with stress and how you relate to your environment in other ways is also very important. So number one are hidden food sensitivities. And I cannot stress enough how important it is to explore this for yourself. Now, when it comes to food sensitivities, you can go and get testing. Now, I'm not talking about food allergies. That's sort of a different, it's a different way of looking at it or understanding this. So there are people who have food allergies and they know it because they have an instant reaction. So if you eat peanuts and you have a peanut allergy, you'll either start, breaking out in hives or itches or rashes or whatever, or worse, and you'll go into anaphylactic shock. That is an immediate response. There's a different way that we can respond to foods. We call them sensitivities. And you can get tested for those as well. It's mediated through a different immunoglobulin in your body. I do not find that testing to be accurate or particularly useful. The only way, as far as I'm concerned, to know about your hidden food sensitivities is to avoid those foods. And you have to do it for a good 6 to 8 weeks. This is what we call an elimination diet. The four most common culprits here are written there for you: gluten, dairy, corn, and soy. Now, gluten sensitivity is another one that can be tested for. The typical medical permutation of that sensitivity is called celiac disease. and there's testing that can be done for it. And I have to tell you that I've got a ton of patients who get tested who are told by their doctor that they do not have a gluten sensitivity, and yet when they get gluten out of their diet, their life changes. And I want to share a story with you about that woman that I told you came into my office, sat down and looked at me and said, I do not know a day without pain. I haven't for 20 years. We went through her stuff and determined that gluten was probably an issue. And so I got her on a gluten-free diet, and she was really good about it. Now, this is going back a while. Resources weren't as readily available to be on a gluten-free diet as they are today. I'm talking about maybe 10 years ago now. Now, if you just, many restaurants are listing on their menus which foods or which offerings are gluten-free because of how prevalent this has become in our consciousness. So this woman was really very steadfast in this. And I always tell people, if you have a gluten sensitivity, you have to be neurotic about it. You have to avoid gluten completely. And that means that there are all sorts of food additives that actually contain gluten. And so you have to really educate yourself and just be a nut about it. And she was a nut about it. So it's not just avoiding wheat and oat and rye and kamut, spelt and barley. It's also all of the food things. For instance, if you are eating a food that says caramel coloring, that has gluten, or hydrolyzed vegetable protein, it has gluten. Or if you're, eating soy sauce, most soy sauces have gluten in them. So she was really good about it, and she did it for 8 weeks like I asked her to, and she came back, and she sat down, and I said, well, headaches improved? And she said, no, not really, just slightly better, but not that much. And obviously we were disappointed, and we went through her diet pretty closely, and she was very good about it, except for one thing. Every Sunday when she went to church, she was getting a wafer, and that wafer contained gluten. And when she got that out of her diet, she, procured some gluten-free wafers that she took with her to church. Her headaches went away and went away for good. So the illustration there is that you have to be neurotic about it, and it can take a small exposure to keep you in your cycle of having those headaches. And the other illustration is she was only getting that gluten once a week, and yet the headaches didn't go away. It can take weeks of avoiding a food before you see the benefit of it. And so if you listen to this and you say, yeah, this makes sense, I'm going to get off of gluten, and you do it for a week and you say, I'm still getting my headaches, you didn't learn anything. You have to do it for a good 8 weeks. So dairy, corn, soy, there's a whole mess of foods that you can have sensitivities to. So what I wrote here is Paleolike diet. And the reason I do that is because I don't think that we can actually be on a Paleolithic diet, because the foods that we have available to us today are vastly different than the foods that we had when we were Paleolithic men. I mean, if you want to just take carrots as an example, the carrots that you get today or that you can get today are vastly different. That's not to say that a carrot today isn't good for you, and a carrot, that you only should eat carrots that our caveman ancestors ate. That's not the point. The point is that we really can't have those same exact foods, but what we can do is follow the idea. And one idea and one important thing to understand is that Paleolithic diet did not contain grains as a staple in our diet. And in fact, for the vast majority of time that we've been a species on this planet, having grains as a staple in our diet is a relatively new phenomenon. And we have not been doing it long enough to allow for genetic changes to happen to make it so that we can thrive under that condition. By the way, the same thing exists about living indoors. That is a relatively new phenomenon for us. And not having exposure to the sun, and thus the vitamin D that we make from exposure to the sun, is a huge issue and has huge health implications. That was just a side note there. But the point being is that we should only eat foods that do not require processing to eat. So if you could actually just, find a stalk of wheat and chew on the end of it, that would be okay. Of course, you can't. The grains have to be processed in a specific way to actually turn them into food that we could eat. It's not good for us. That's just the bottom line. And there are all sorts of implications to having grains in our diet. And I think it's probably the main underpinning of why we have such chronic disease in our society today across the board. Now, which disease will happen to an individual as a result of having grains as a staple in a diet will differ from person to person. This is one of those difficulties. So, but I'm telling you that that is the underpinning of every one of the chronic diseases. Every single one of them that we're trying to avoid, whether we're talking about sugar issues or cardiovascular problems or structure issues and osteoporosis or emotional issues like depression or anxiety or even migraines. Having grains as a staple in our diet is a big issue. And so I did a webinar specifically about being on a grain-free diet. I did it a few months ago. And so if you want to explore that further, you can just go to the website and check out the archives and listen to that. Grain-free. In fact, I challenge people to do it for 8 weeks. And you will find it particularly useful if you are suffering from migraine headaches. Almost completely across the board you'll see benefit from that. It will also affect your waistline and your energy and your mood and your sleep and all sorts of other things as well. And Jerry wrote in, that's a pretty bold statement. I'd like you to explore that further, and a little smiley face. And yeah, you should explore that further, Jeremy. And the first step would be to go to the webinar where I talk specifically about grains and why that's such an issue for us. And I also challenge people to take an 8-week period of time and be completely grain-free. Completely grain-free. And then you sit down and say, is there value in doing this? I'm not like the rest of Western medicine where we live by the idea of you go to your doctor and doctor tells you what you must do. That doesn't work in real life. What I want people to do is understand the ramifications of their decisions, and then you can decide if you want to do things differently. So here's the deal. If you say, hey, that makes sense, I want to take a 2-month period of time of my life and experience something different, and you get off of grains completely, and you have to be neurotic about it, and it's not just, all right, I'm not going to eat bread. That means bread, pasta, cereal, anything that's grain-based, and also understand that grains and grain-derived foods are oftentimes additives in foods, and so really what you're also committing to is not eating foods that come out of packages, making the foods yourself so that you know exactly what's in there. Understand also corn is a grain, and so anything that has high fructose corn syrup, you got to avoid all that sort of stuff. Do it for 8 weeks, and then sit down and say, okay, what's different? And oftentimes with my patients, even though they may have come in for, say, migraine headaches, when they come back, they'll say, yeah, the headaches are gone. That's great. But also I'm noticing I'm sleeping better. My mood is better. I've lost a couple pounds. My energy is better. I feel sharper at work. All of a sudden I like my husband or my wife better, or my husband or wife like me better. All sorts of things change. After you do that experiment for 8 weeks, 2 months, you sit down and say, all right, what's changed? And then you can say, hey, is that important enough to me? If you say, you know what, my headaches went away, but darn it, pizza's more important to me. I'd understand that, and I'd support that. I'm not here to tell you you can't eat those foods. I'm telling you that it's affecting your health, and that if you want your health to be different, then you have to change your diet. Let's see, I got a question here from Valerie who's saying, I went from constant headaches to 1 or 2 times a month by going grain-free. So there's an example of that. Thanks for sharing that, Valerie. I really appreciate that. So from constant to 1 to 2 times per month is a huge change. Now, what can we do to get you from 1 to 2 times a month to no times a month? And that's where some of these other things may come in as well. But I really appreciate you sharing that for me. Okay, you have to avoid chemicals and flavorings and artificial sweeteners. And again, we're talking about cleaning up your diet. Now, if we had a kid that had ADD, ADHD, we may be talking about a Feingold diet. And it's the same sort of thing. It's just getting the junk out of our system that is affecting things in ways that we may not be connecting to the symptoms that we're showing, especially with headaches. You also need to avoid high glycemic foods. And I had mentioned this earlier, and this one often gets missed. If you go and, you go to the Mayo Clinic website or WebMD or whatever, and you talk about migraine headaches, they're going to say, okay, well, you got to avoid the cheese and the chocolate and the wine, those typical foods that you hear about. But part of what could be the underpinning in certain susceptible people is the sugar spike and the resulting insulin spike that happens that can result in migraines in certain people. And so high glycemic foods are foods that not necessarily, we're not talking about how much sugar is in the food, we're talking about how quickly the sugar hits your bloodstream. So obviously we're talking about cakes and candies and donuts, but we're also talking about anything that's grain-based because those are all high glycemic foods. Yes, I'm saying 12 grain whole wheat bread for most of us is just like having a Snickers bar. And if that's the case, I say have the Snickers bar because, that's obviously more fun. But those foods need to be avoided. Now, if you talk about a strawberry, it has a fair amount of sugar in it, but when you eat that whole strawberry, you get it with enzymes and fibers that mitigate how quickly the sugar hits the bloodstream. You get a more measured response, and so then your body can respond by releasing insulin in a more measured way as well. And that insulin and high insulin levels ultimately becomes a trigger for many chronic diseases, including migraines. Okay, so that's step number one, diet. Step number two has to do with stress. And I can't emphasize this enough. I was going to say I can't stress it enough, but we don't want to stress that anymore. I can't emphasize enough that stress affects everything. Sleep, blood sugar, hormonal balance, all of that stuff is affected by cortisol levels in your body. So I want to be clear about this. I'm not saying that we should avoid stressful situations because we really can't. It's how you respond to those stressful situations that you can control or do differently. So just a quick example or an illustration. So I want you to imagine that we have a roller coaster that two people are going to go on, and one person absolutely loves the roller coaster. So, when they're waiting in line, they're anticipating the ride, their blood pressure and heart rate will go up. They create endorphins because of their excitement about it. They go on that ride, and it's the thrill ride that they expected it to be. And like I said, their blood pressure and heart rate go up. They get off the ride, and it's like, oh, that was great. They've got all those endorphins, coursing through the system, and blood pressure and heart rate actually come down, maybe even below where they started. The second person who's going to go on the ride, that scares them to death. They think that they're actually going to die on that ride. And so while they're waiting in line, it's that white knuckle experience, right? So while they're waiting in line, instead of creating endorphins, they're actually creating cortisol, which is the hormone of stress. Now, blood pressure and heart rate go up. Immune system gets affected by that. They go on the ride and they think, oh my God, I'm coming near the end. They get off the ride and they remember when they came near death. And their cortisol levels stay elevated and their heart rate and their blood pressure stay elevated. Now, the interesting thing about this illustration is that roller coaster ride was the same for both of those people. It's not the ride, it's how you relate to the ride. The ride that is your life, you're not going to change that, but you can change how you relate to it. So I sit with people all day long and they tell me it's their husbands and wives and parents and kids and bosses, and they go out and get new husbands and wives and parents and kids and bosses, and nothing changes. And that's because it's not the ride, it's how you relate to it. I did a whole webinar about stress that I think is important to understand in more detail, the effects of cortisol and how in the short term that's actually life preserving, but in the long term it's actually life altering. And the same can be said with the migraine headaches and its result. Step number 3 has to do with supplements. And so I'm going to go through a bunch of supplements here. And again, I said this at the beginning, but I just want everybody to understand that I'm going through a grocery list of what may be helpful for people. And I'd be interested in knowing what you've tried and what you haven't tried and what's worked and hasn't worked, but understand that it's very individual. And if you're on certain prescription medicines, we might use these supplements in a different way. And so my point here is not for you to necessarily just run to the health food store and buy every one of these supplements and start taking it, but explore how they would affect you as an individual under your unique circumstances with the medicines that you may be on or whatever. And I'm available to help you do that if you would like. All you got to do is call the office or email me, just go through the website, and I'll be happy to respond to you and help you understand how these things might be helpful for you. So number 1, I want to talk about some common botanicals, and you've probably heard of these already. If you are a migraine sufferer, I'm quite sure you have, because you've looked for other options. And so number 1 is Feverfew. So Feverfew, it has been used traditionally for treatment and for prevention. And so if you are having a migraine headache, taking Feverfew may be as effective, and there's some studies showing that it can be as effective as other pharmaceuticals. And there are some people who take lower levels of it on a regular basis to help. And the reason it can be helpful is it can help stabilize the mast cells, which are the ones that release histamine in the body, and it can also help stabilize the serotonin levels within the platelets that we talked about a little bit earlier. Ginger is another herb that people use. It's an anti-inflammatory and can be useful for treatment and/or prevention. And I'm a big fan of having ginger as part of your daily supplement, anti-inflammatories. And then I'll say a newer one because it's been used for thousands of years, but one that's newer as a supplement is called butterbur. And again, same thing, has some physiological effects in the body that seem to be helpful for treatment and/or prevention of chronic migraines. I also want to talk about some nutritional supplements. And there's a whole host that are listed here. So number one is 5-HTP. I don't know if you've ever heard of that before. It stands for 5-hydroxytryptophan. And this is the immediate precursor to serotonin in the body. The way it works in nature is you eat something that has protein. One of the amino acids that's in that protein is called tryptophan. The body will convert the tryptophan into 5-hydroxytryptophan. That in medicine is what we call the rate-limiting step, or chemistry. That's called the rate-limiting step. So that's a slow process going from tryptophan to 5-HTP. And then the body will take some of the 5-HTP and convert it into 5-HT, which is also known as that character in the play we've been talking about, serotonin. So one of the ways to balance your serotonin levels is to take the amino acid that's the precursor to serotonin. This is the body-friendly way of increasing serotonin levels. And in essence, what you're saying to your body is, hey, if you need more serotonin, here's more of the root material, go ahead and make it. It can get a little bit more complicated than that, as you can imagine, but 5-HTP is a readily available supplement over the counter. If you are on an antidepressant, either one of the older tricyclics like Elavil or whatever, or one of the newer SSRIs like Prozac or Zoloft or whatever, you have to be careful using 5-HTP because there is such a thing as getting too high of a level of serotonin or serotonin syndrome. And so this is one of those things where you need some help in using it appropriately. Studies have also shown with migraines that the longer you use 5-HTP, the better the result is. So this isn't like, all right, I'm going to take 5-HTP and in a week my migraines are going to go away for good. And studies have shown that being on it for 60 days consistently has shown better results than being on it for 30 days. And so this has to do with not just your serotonin levels, but your reserves of serotonin and your body's ability to use serotonin appropriately and your body's serotonin receptors working appropriately as well, which can work inappropriately when you don't have consistent, steady levels of serotonin. Healthy fats play a very, very important role with cells communicating with each other appropriately. And so I'm talking about fish oil here. And again, I did a whole webinar. I could talk for hours just about these healthy fats and how they play a role with what goes in and out of cells and what reacts on receptor sites of other cells. But you should be on fish oil. Everybody should be on fish oil, but specifically if you're a migraine sufferer. And a part of that has to do with your brain chemistry, because you can't have balanced brain chemistry without having appropriate balanced fats in your diet and in your body. I wrote B complex. The B vitamins, I had mentioned one of them earlier that plays a role with a specific enzyme that helps to cut down on the absorption of histamine from histamine-containing foods. Another one of the B vitamins called folic acid is very important. Now, in your body, folic acid gets converted into its active form, or I should say is supposed to get converted into its active form, which is called 5-methyltetrahydrofolate. And that is a very important cofactor in making serotonin. Again, that important brain chemical that we're going to concentrate on. And so there are about a third of the population that walks around with the genetic kink where they can't convert folic acid into its active form. So when we talk about migraine headaches and that there is a genetic component to it, maybe that's it with you. Now that can be tested if you want. You can go to the doctor and say, hey, do I have that, that quirky thing where I'm not converting folic acid? It's called MTFR, is the testing that gets done for it. Doctors are more and more familiar with it these days. But I'm not sure I'm a big fan of doing the testing because actually another third of the population, because of stress and chronic gut dysfunction, don't convert folic acid into its active form. And so if you go and get the testing and say, oh, well, that's not me because genetically I don't have the quirk, that doesn't mean that you're able to convert. And so one of the B vitamins that we would use is the active form of folic acid, which will help your body make more serotonin. It has some other effects in the body as well. So if you're going to take a B complex, you want to take one that has the active forms of the Bs in there. And if you're talking about, that big tub of B complex that you get at Sam's Club, that's probably not the right one. A specific brand that we would use is called Pure Encapsulations, and they have a product that's called B Complex Plus, which has the active forms of all the Bs in there, likely more effective to help in this particular issue. Magnesium also plays a very important role. And if you've picked up a book or done a Google search for a holistic approach to migraine headaches, you'll read about magnesium. There are specific forms of magnesium that the body absorbs and uses much more efficiently than others. And there's one particular product by Life Extension called Neuromag, which plays a role with magnesium levels within the brain, which plays a role with balancing things out appropriately. Quercetin. Quercetin is a natural antihistamine. It helps stabilize mast cells. So we use that for allergies during the allergy season, but for someone that's a migraine sufferer, being on quercetin on a regular basis may also be helpful for you. And then I also put digestive enzymes, because if you're not digesting food completely, that can also play a role with all of this. And so a plant-based digestive enzyme, and again, I did a whole webinar just about digestion and the use of digestive enzymes and why it's important. Adrenal support is also important. This comes with the whole stress thing. And so there are people that we call stress types. And so there are people that over-respond to stress. So they're the ones that get nervous and anxious when they're under stress. And there are people that are under-responders. So those are the ones that are more burnt out. And when they get under stress, they just want to get in the bed and pull the covers over their heads. So there are different formulas that we use depending on how you respond to stress. And all of these formulas have different combinations of herbs and nutrients that are known as adaptogens that calm adrenal response to stress. And so there's one that's called Power Adapt. That's for the under responder. That's the one for people that get low energy. And there's one called Cortisol Calm, which helps calm everything down for the people that get overexcited. Sleep support is also really important. Come back to 5-HTP, because when you have low serotonin levels, you're not sleeping properly. Melatonin is another thing that you'll find studies about in relation to migraines. And then there's a whole bunch of different various herbs that can be helpful with sleep, hops or passion flower or valerian. I don't like to use any of these things individually. I don't like valerian that much at all because it has a tendency to cause like a hungover feeling in the morning. But you'll find combinations of all of these things in different sleep formulas, which can be helpful as well. If you have any questions that I haven't addressed, now's a good time to sort of type it in, because as I look up on the clock, I see that it's been 55 minutes already, and we have just a couple minutes left. While you're doing that, or if you're doing that, I just want to point out that I do these webinars once a month. The one coming up in May is actually about travel. Are you planning to travel, especially if you're planning to go to a foreign country or foreign areas? There's a bunch of things that you can do to protect yourself to stop you from getting gut problems in particular, but also immune issues that oftentimes happen when we travel and stress ourselves. And also, again, our webinars are archived, and so we have all sorts of topics, including the ones that you see there: stress and weight loss and sleep and cholesterol and osteoporosis and a whole host of other ones, probably 3 dozen of them now. And I would encourage you to go and educate yourself about that stuff. Not seeing anybody type in any questions, so that means that I must have done an excellent job covering the topic, or everybody's asleep. So now it's time to wake up. And I do want to tell you, honestly, that I really appreciate your willingness to spend some time with me. I know that we're all busy. I know that spending an hour trying to digest some information sometimes can be challenging, but I really appreciate and honor your willingness to spend some time with me, and hopefully you found it useful. Please do get in touch with me any other time to get help with this topic or anything else that is bothering you health-wise. I really look forward to you guys joining me again at a future date. Everybody, have a great day.